The Ghana National Chamber of Pharmacy, together with the Pharmaceutical Importers and Wholesalers Association of Ghana, are agitating over a proposed restriction in the importation of some 142 pharmaceutical products by the Ministry of Health. Now, the two bodies have expressed concern that such imposition of restriction will inevitably result in drug shortages and surge in drug prices. There's more in the following report.
The Chamber explains that the Pharmaceutical Manufacturers Association initially submitted a list of 116 products to the Ministry of Health. The Food and Drugs Authority subsequently advised the ministry on the restriction and recommended only 38 pharmaceutical products for the import ban, citing the unavailability of special laboratories and the capacity of local manufacturers. This list has since been expanded to 142 products without any engagement with major stakeholders. President of the Pharmaceutical Importers and Wholesalers Association, Dr. William Addo, strongly asserts that the Ministry of Health's import ban on 116 pharmaceutical products will have severe repercussions on the health sector. He warns of a looming drug shortage, emphasizing the adverse effects this restriction could have on public health should the restriction be implemented.
Somewhere in 2016, pursuant to EI 181, the importation of about 49 products were restricted for the sole manufacture of local companies. Then about 2-3 years ago, the local manufacturers applied to Ministry of Health for further additions to the list without any review of the previous 49 products. We asked for the data and no data was provided on that. Whether they did well or not on the first 49, there was no data on that. This time, they proposed 116 products to be restricted. After going through the list thoroughly by Food and Drugs Administration, Food and Drugs Authority of Ghana, and lest I forget, Food and Drugs Authority of Ghana is amongst one of the best pharmaceutical and food regulatory agencies in Ghana. In fact, our FDA Ghana is a WHO GBT. It's a global classification, level 3, very, very high. Recommended the ban of only 38 products. However, as we speak, the proposed EI draft by the MOH seeks to ban 142 products. Based on which data? No data. The dangers ahead is going to affect you, it's going to affect me, because it can lead to drug shortages, hike in prices, drug security, and it can even collapse our national health insurance because the drug bill is going to shoot up.
The Chamber and the Pharmaceutical Importers and Wholesalers Association are calling for a comprehensive review of the import policy to prevent potential disruptions in the availability of essential medications.
The finalization of the EI in its current form be suspended immediately for a broader engagement with key stakeholders like parliamentarians, policymakers, service providers, manufacturers, regulators, importers, research centers, practitioners, and Ghanaians for their perspectives and inputs. We are also calling on the minister to adjust the timelines for the restriction of the various classes of the products to make room for critical national interventions prior to their implementation. These include, firstly, the establishment and operation of the functional system for data collection and analysis on the capacity of local manufacturers to meet national needs of medicines restricted under EI 181. Secondly, the establishment of effective support infrastructure like contract manufacturing plants in at least 3 locations in Ghana to significantly reduce the existing barriers to local manufacture. We're also calling the minister for the immediate restriction should only be on the 38 pharmaceutical products recommended by FDA, as they are backed by the necessary regulatory support.
Well, joining us for more on this is lawyer Nelson Oswansa, who's consultant, researcher, health policy analyst. He doesn't believe the policy will benefit the country in the long run. Why do you think, well, I'm grateful to you for joining us here, lawyer. Why do you think that this sort of policy will not be in the interest of the country in the long term?
Thank you very much for the opportunity, and good afternoon to yourself, your viewers out there. Now, as you have rightly indicated, we are very much opposed as the Ghana Chamber of Pharmacy and also the Pharmaceutical Importers and Wholesalers Association on the grounds that, generally we would have been all happy to support the government to actually improve upon issues. So with the fact that this proposed EI is basically trying to restrict medications from 49 products up to 142 products.
Okay.
Now one would ask, what kind of data does the Ministry of Health have? What kind of analysis have they done to ensure that these 142 products, which are currently being served by over 300 importers, if you restrict it to only just 1 or 2, for some of these drugs are highly emergency drugs, such that it would be very, 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 very unfortunate if, for example, you find yourself in an emergency situation in a theater and you need certain anesthetic drugs, and the one single producer tells you that I am unable to deliver. What does it mean? It means the lives of the poor patients, the lives that you and I, the ordinary Ghanaian, we are the people who are going to suffer. So what we are saying is that the Ministry of Health should, with immediate effect, suspend the implementation of this EI and allow for broader consultations with all the major stakeholders.
Well, but we also do know that there are some companies that are into the manufacturing of drugs here.
Yes.
Don't we have the capacity to be able to then, produce or manufacture these drugs that the EI intends to suspend their importation?
Now, per the Ministry of Health's own report about some of these drugs that these manufacturers were supposed to have supplied the Ministry of Health only, the report indicates that some of them were not even able to supply just the Ministry of Health. Okay, now this EI seeks to restrict these medications in terms of import on the entire country. So the question is, if you are unable to supply Ministry of Health framework policy, some of these drugs, because of A, B, or C reasons, how do we believe that you would be in a capacity to be able to supply the whole country, especially so when these drugs are provided by 300 importers and you seek to restrict it to just about 1 or 2? And it's not just a single drug. We are talking about 142 drugs. Some of them include antihypertensives. Some of them include antidiabetics. And these drugs are key to the lives and sustainability of people who have hypertension, diabetes, and so on and so forth.
Well, I guess, I mean, from what you're telling us, it's about capacity of the local producers to produce.
Yes.
So why aren't we campaigning or advocating for the development of local capacity for us to meet, you know, that deficit that a restriction will bring, so that we can keep some of these monies that are used in importation in the country?
We are all for increasing the local capacity. Nobody is against it. And get this right. In fact, the introductory comments as far as our write-up press release is concerned clearly indicated that we are not against the government's broad objective of boosting local manufacturing. The question to ask here is that at this stage, and given the capacity of the local manufacturers, will they be able, within this short period of time, to meet up to the national demands? The answer is clearly a no. Beyond that, all countries who want to boost national production and all that, what they do is that they put in policies that would rather lower the barrier entry, so that you have a lot more indigenous companies. Like producing the same thing, prices are forced to go down. Here we have it in a different way. You have just about one or two companies who are being sought to basically do the production. What is going to happen? We are going to create a monopoly. And when you create a monopoly, prices go up. And when prices go up, you know, people may not be able to afford, and some of these things are very, 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 very life-saving.
Okay.
And there would be shortages.
Okay.
If we are not careful, there will be shortages of drugs, and people will not be able to get the drugs, even if you have the money to buy it.
Interesting. So you want government to probably stagger the implementation of such an EI, or what exactly do you want?
Exactly. We want the government to pull the brakes. Basically, we want the government to consult broadly on the scope of the EI, the drugs that these EIs seeks to cover, as well as the timelines for the implementation. For some of them, it is with immediate effect.
Okay.
And those ones, they are not just one or two items. We are talking about a good number of molecules.
Okay.
What capacity do we have to, if tomorrow the minister finds it and it is gazetted, it becomes law.
Okay. All right.
And do the capacity.
All right, Lawyer, I'm grateful to you for joining us here, and we wish that you know, government will listen and the right things will be done. Grateful to you for joining us.